24th of January 2014 is the day New Hope for Mothers was born, to be able to carry their pregnancies to full term and their children to live beyond their 5th birthdays. 1 in 300 Kenyan women die while giving birth. For years, this has been the reality in Kenya. And in every 1,000 women, 5 die while giving birth or due to pregnancy-related complications, and at least 5 in 100 children die before the age of 5. Kenya is among the 25 countries with insufficient progress in curbing the under-5 mortality rate. This painful reality gave the First Lady Margaret Kenyatta sleepless nights.
The one that disturbs me the most is infant mortality. When mothers go to the clinics and either both don't survive or the child doesn't survive, that's one of the main ones in the rural areas.
The First Lady resolved to make a positive contribution towards Kenya's health targets and launched the Beyond Zero campaign. The campaign initiative is guided by a strategic framework that provides an impetus for high-impact catalytic interventions towards zero preventable deaths of mothers and children.
Having had children in a more privileged way, it's devastating to know that there are mothers who die giving birth, children who don't survive immediately after, or it's heartbreaking for any mother.
Maternal and child mortality is very rampant in Kenya. Despite the commitment of the country's healthcare sector, there's still much to be done. There are on average 488 deaths per 100,000 births in Kenya, and this number is still quite high. To try and bring a solution to the problem, the Beyond Zero campaign tries to reduce or completely eliminate social inequities for essential health services, particularly maternal, newborn and child health services.
We do lose a lot of children, and malaria is one of the biggest ones, and HIV as well. Beyond Zero is health in Kenya, beyond the fact that what we've been working for is no death. Next, we need a healthy nation. When we have no deaths, unnecessary deaths, then we need to build on a healthy nation. And through this position, I can get funding, donors, and I intend to take advantage of that.
Margaret Kenyatta promised to raise funds to provide mobile clinics to all the counties to improve access to healthcare for mothers and children.
Through the Beyond Zero campaign, each county will receive a mobile clinic that will contribute to improving access to healthcare for mothers and children. We will prioritize counties based on HIV, maternal, and child health indicators, and eventually all counties will be covered.
Donors and private sector organizations supported the First Lady by pledging funds and also helped purchase some mobile clinics that will provide integrated HIV, maternal and child health outreach services in the country.
I would like to take this opportunity to thank all the sponsors and donors and well-wishers of this cause. In particular, I would like to thank General Motors for providing a prototype of this mobile clinic. I would also like to thank the technical team led by the Ministry of Health, who have worked so hard to support this initiative, and I urge other like-minded partners to come on board because there still remains a lot to be done.
The Ministry of Health, with the Beyond Zero Technical Committee, designed the fully kitted mobile clinics with its 52 equipment. The mobile clinics are strategic instruments for strengthening and complementing referral systems within counties.
My dream for Beyond Zero is a women and children's hospital. Well, actually, probably more than one. But we still need to deliver many more clinics to the counties. like especially in the northern part of Kenya, they need many more mobile clinics with the nomadic communities. Once we hand them over to the counties, it's them who actually deal with it together with the Ministry of Health, and they have made a promise. So I'm sure each county is doing what it needs to do for its county.
County governments, Ministry of Health and Beyond Zero have signed 43 memorandums of understanding that demonstrate transfer of ownership and corresponding accountabilities. Appropriate designed messages on maternal, neonatal and health, child and HIV have reached over 14 million Kenyans. 250,000 Kenyans have received a service in the Beyond Zero mobile clinics, and the greatest beneficiary has been the child. The initiative has mobilized 500 million Kenya shillings through private sector social investments. The Beyond Zero mobile clinics have covered over 100,000 kilometers, moving from one sub-county to another, providing free services.
Eyes have been going to the counties and seeing physically the clinics in action, and also training in various counties. Those have been the highs. The lows have been the aches and pains of the training.
Taita Taveta County were the first beneficiaries of the mobile clinics. County First Lady Mrs. Hope Murutu said that residents who could not access the treatment at the health facilities can now get the treatment at their doorsteps. Turkana was the 8th county to receive its mobile clinic under the Beyond Zero initiative. First Lady Margaret Kenyatta launched the clinic in Lodwar town to aid thousands of women in the county.
Turkana County must invest in increasing the proportion of women who deliver hygienically and clean, safe facilities.
We are working tirelessly to implement current best health practices, while in the same vein come up with appropriate county-oriented solutions to prevent new infections and put on care and treatment of our brothers and sisters already infected.
Statistics indicate that Turkana is home to almost 45,000 Kenyans living with HIV and AIDS. The county is the 7th out of 9 counties that account for 2/3 of all new HIV infections in Kenya annually. The high number of new infections means high cost of treatment in future.